Hello, my name is Dominique Levy, and today I'm going to be talking about how HbAS genotype is most likely to be successful in protection against malaria infection. So, malaria is a potentially life-threatening disease that is caused by Plasmodium parasites, and these parasites are transmitted through bites of infected female Anopheles mosquitoes. When an infected mosquito bites someone, the parasites enter the bloodstream and travel to the liver, where they multiply and mature. After a few days, the parasites leave the liver and infect red blood cells, and this is when the typical symptoms of malaria occur. For the experiment, a study was done on 600 symptomatic malaria patients with ages ranging from 1 to 88 years old in 10 regions in Ghana. The majority, 79% of the participants had normal hemoglobin genotype, which was HbAA, followed by HbAS with 11%, and HbAc with 6.7%. HbAc refers to hemoglobin AC. This is a combination of hemoglobin A and hemoglobin C. Hemoglobin A is a normal type found in adults, while hemoglobin C is abnormal and can lead to anemia. HbAS is also a combination of hemoglobin A and hemoglobin S. Hemoglobin S is an abnormal type associated with sickle cell disease, and individuals with HbAS genotype are carriers of the sickle cell trait. HbAS genotype is most likely to be successful in protection against malaria infection because HbAS has been linked to a large amount of P. falciparum infections, which suggests an increased width of antibody responses. This study shows that high IgG antibody levels are associated with malaria infection, whereas HB traits such as HbAS and HbAc protect against P. falciparum infection. IgG antibodies are a class of antibodies that are the most abundant type in the bloodstream that play an important role in the immune response and provide long-term protection against pathogens. Low IgG levels explain the counter effect of hemoglobin variants have on antibody development. So this graph shows the distribution of parasite density among the hemoglobin variants. You can see that the HbAA hemoglobin type has a higher density of parasites compared to HbAc and HbAs. Malaria parasite density is the concentration of malaria parasites present in a given volume of blood. It is usually measured by counting the number of parasites observed in a microscopic examination of a blood smear. These measurements are important in diagnosing malaria and assessing the severity of the infection. So you can see that if an individual had the hemoglobin type HbAA, they had a more severe case of malaria compared to those with HbAS genotypes. So in conclusion, understanding the interplay between hemoglobin genotypes and immune responses is important for guiding public health strategies, advancing medical research and innovation, and optimizing patient care. More specifically, people with different hemoglobin genotypes may display variability in their immune responses to P. falciparum infection.